Yeah, good afternoon. Good afternoon. Good afternoon once again. Thank you for liking. Thank you for subscribing to my station. Thank you for liking. Thank you for sharing. Thank you for the comments. I really appreciate all of it. So today we'll be continuing our health talk with Nosulua Sheyi. So today we'll be looking at how to make our homemade ORS. What is ORS? ORS is oral rehydrating salt or oral rehydrating therapy, ORT. And what are the indications for ORS or ORT? Who are those people that need ORS? Why do they need ORS? One, people that have mild dehydration, they need ORS. How do you know that a person is dehydrated? I told us that there will be sudden weight loss. There will be sunken eyes. The person's eyes go deep inside. There will be poor skin elasticity or poor skin tugor. That means when you pull the skin, normally when you pull the skin of a person, the skin is supposed to return back immediately if the person is well hydrated. But for a person that is dehydrated, you will see that the skin will lag, it will stay there, then it will start coming down gradually before it returns back. This is not supposed to take so long a time, but for people that are dehydrated, you will see that that will happen. So who are those people that need rehydration or ORT therapy? One, people that have mild dehydration. People with diarrhea, they need ORS or ORT. Then for people that have excessive thirsts, they need ORT. Then for electrolyte imbalance, people that have lost electrolyte in the body, they need ORT or ORS. Then for cases like cholera and so on and so forth, they need ORS. So what are the contraindications of ORS or ORT? First, people that have profuse vomiting. One of the indications for ORS is vomiting, but when the vomiting is too much, then such an individual most likely will not be able to tolerate ORS. So it's a contraindication for ORS. Respiratory problems, people that have respiratory problems is a contraindication for ORS. Then people that have lost body fluid that is greater than 10%. People that have lost body fluid that is greater than 10% is a contraindication. They cannot be taking ORS. An individual that is already in shock or unconscious patient cannot take ORS. When there is profuse vomiting, such an individual cannot take ORS. So what is the dosage for ORS? The dosage. How do I make my homemade ORS? At this point, please call that your neighbor, call that your friend, call that your colleague, and please listen to Nurse Oluwaseyi as we dive into how to make our homemade ORS. Please take note that there are ORS already made in a pharmacy, in a stores, pharmacies, and so on. You can get the ready-made sachet. But for instance, in the case of an emergency or you need it at an hot time and you don't have it at home, you can make your ORS on your own. You can get a bottled water, but ensure that the bottled water you get is a clean one, a registered one that is NAFDAC approved. Or you can boil your water at home and get 1 clean liter of water. Ensure that this water cools down to room temperature. Then you will get your teaspoon. Please look up. This is your tablespoon. This is your teaspoon. For you, this is what you need to make your ORS. You make half level salt of your teaspoon and pour in a cup of that boiled water. Pour it in it. When you pour it, stir it and ensure that you mix thoroughly. After stirring, then get 6 teaspoons of sugar and pour it inside this already made salt solution. Pour it and stir thoroughly. After stirring and it is evenly distributed, it is dissolved, well dissolved, then you pour the remaining portion of your 1 liter, pour it to make 1 liter, then you continue to stir. After stirring, pour in your bottle or bottles and cover it. But please take note, your ORS or ORT solution is valid for only 24 hours. After 24 hours, it is no longer safe for consumption. So if after 24 hours your patient, your person, that individual has not taken that ORS solution, then it should be discarded. The remaining should be discarded and another one should be made. Then what is dosage for the ORS solution? For ORS solution, for infants under 24 months, they need 50 mils to 100 mils, 50 to 100 mils after every loose stool. That means that for a patient, an individual with diarrhea, he or she needs, for an infant of less than 24 months, he or she needs 50 to 100 mils of ORS solution, while a patient or your child with 2 to 10 years of age needs 100 to 200 mils of ORS solution after every loose stool. But the that individual must not take more than 1000 mils. Must not take more than 1000 mils. Then for 10 years and above, for individuals that are 10 years and above, can take 200 to 400 mils of ORS. But the maximum that should be taken should be 2000 mils per day. It should not exceed that, so that the point is we do not overload the heart, because it can lead to cardiac overload. So as much as you want to rehydrate the person, you don't want to overload the person too much too. Too much of everything is not good. So ensure that the person follows the normal dosage. And if there is no diarrhea after that first dosage, you can administer after 4 hours to ensure that the person is well hydrated. But please, as much as we are trying to rehydrate an individual, ensure that you do not over hydrate the individual. You have watched this video till this time. Oh, thank you so much for watching. Please ensure you subscribe to my YouTube channel, like, share, comment. It goes a long way to encourage this video. Thank you so much. So the next video is going to be on hand washing technique. Thank you. Thank you. Thank you. Thank you. Have a nice time. I'll see you next time. Bye.